all minimize the risk of falling. So how do we minimize the risk of falling? By not doing risky activities. That is definitely one way, because if I drive a car at 4 in the morning, I have other people who are doing high risk behavior and don't care as much about their own safety that I will get hit.
I was just drinking and smoking while you were driving. So.
Or texting.
Or texting. Yeah.
What were you smoking?
Yeah. My high risk behavior.
So we must minimize high risk behavior. So you must do, in terms of risk taking, you must do what is necessary and back off from what is not necessary. So let's say your necessity is cooking. So in the program, they want you to organize your kitchen in a way that you don't have to take the risk of turning around and around and around and around multiple ways. So what should you do? Things that you use frequently should be right here with you. As you're cooking, once you go out to clean, everything that you need should be right here with you. So that you don't have to go turn around and come do this. Smart. Your chopping board should be right here, right next to your cooking area. Chopping done, everything goes in. If your washing area can be right here as well, even better. So that you don't have to turn around, because every time you turn around, you are twisting the entire weight, stopping it, and then coming back and doing the same thing. We know that more times that you do such things, better your balance will be. But why will it be better? Because you are pushing yourself to the limit by taking a risk. We don't want that. We want that to be done only when the purpose is there. Then of course you might have talked about climbing steps. That how the leg that is better, stronger, should be the first leg that goes up. Yeah? So how do you remember that? The leg that is down is better for climbing down. The leg that is up, which means better, is better for climbing up. Okay? So the leg that is weaker is better for climbing down as the advancing leg. So you go down with that one and then you come down with the other leg. Same, how do you use walkers? I'm glad that none of you need to, but if you ever need to, the walker needs to be at a certain angle for your body. So the ideal degrees is 15 degrees, that your elbow should be about 15 degrees bent. So in the program they say slightly bent. Technically when we fit somebody for their walkers, etc., and adjust the height, we want to see that their arms, the elbows, are 15 degrees bent.
What about the new ones?
Oh, the ones where you put your arms on top?
Yeah, well, the new walkers, you're standing straight.
Yeah, right.
The straight ones like that?
No, yeah.
We don't use them. Is there an advantage to them?
Well, you're standing straight instead of looking down and walking. You're standing up.
Whenever you walk, your eyes should look far, with or without a walker. Okay, this is the right way. The program actually says that in it, that you must look straight ahead somewhere at an object that is distant from you. Even when I drive, I don't look at the road right next to me. Because if I do, I am going to make so many adjustments that it's terrible for driving. I look far out, and that's when I'm driving. The road is curving, I look far out, and I'm planning my curve accordingly. So your vision should always, when you walk, be straight. Brief looks down and then back up. Brief looks down and then back up. So you clear your way, you look at the obstacles, and then of course you have a way of clearing the obstacles, which means climbing over curves. So the program also talks about...
Are you kidding?
Hi. The program also talks about that, how to climb over curves. The program also talks about letting you know who I am, what I do. So my name is Dr. Malhotra, and there is another Dr. Malhotra.
Hi.
It's so nice. It's so nice to see women doctors, because stereotypically we are all having the image of a doctor as a male. So
Maybe I have to change it.
yes, you girls are changing the word. It's so beautiful. Then we have Moises, who's a physician associate. And then I'd introduce Chad, who is a certified personal trainer and works with many of our patients here in the Port Richey office. We have a gym dedicated to our patients alone because we realize that when seniors want to exercise, they don't want to be amongst those people who are out there muscular, looking at them, when are you going to vacate that machine, etc. Yeah?
What kind of doctor are you?
Internal medicine, primary care. Call me, say, which type of doctor are you? So I say I'm the witch doctor. We do have a happy office. If you ever visit, you will realize that the office has a vibe which is upbeat. Calming yet upbeat, which is what you should have.
Right.
So that you can come, talk to somebody in peace and not feel bad. We like to minimize medicines, which is what the program talks to you about. That take your list of medicines to your doctor who is actually interested in them. To say, how can we reduce your medications? Because you will otherwise suffer a side effect. In our medical examinations, when they ask us about side effects of medicine and you don't know the side effects of the medicine, we say dizziness, and you're always right. Okay? We say nausea, you're always right. Headache, you're always right. So there are less the number of medicines we put on you, less of the chances of these side effects which are so common with so many medicines, particularly blood pressure medicines. We have had to take our patients off blood pressure medicine. The reason? They lost so much weight, they were not the persons that they were. They have transformed. It's a different level. Chad works with them to get them fit. Fitness lowers your blood pressure. During exercise, your pressure climbs up. After that, it comes down. Program also talks to you about gaining more muscle strength, because as you sit up and stand up, these are the pumps that actually push our blood back against the gravity. So if I'm laying down like that and I'm suddenly standing up, I have suddenly pushed all the blood from my head, which maintains my balance, alertness, etc., down to my legs. So what must one do? Step by step. Step by step you get off. You stretch your feet as you sit up. Even before you sit up, you move your legs if you want to. As you sit on the side of the bed, move around, make sure that you are comfortable, you're not dizzy, that you're confident to get up and go. As you stand up, stand by the side of the bed, make sure you're not dizzy, so that as you're going, if you're feeling dizzy, you're right by the bed where you can sit down on the bed again. So safety measures, minimizing risk, improving your strength, lowering your weight, lessening the number of medications, maintaining safety around you, changing your environment and being assertive about it. Why be assertive? Because once you identify a problem, if you're not assertive, the world doesn't want to change for you. You will have to make your environment safe all by yourself. So assertiveness is asserted in this program. That if you are one of those meek, so-called kind people, nobody's going to do it for you. You will need to find the resources. If they do not, you will yourself do it. If you cannot do it yourself, your doctor will do it. We from our office have given out handicap bars to our patients. Why? Because when they are getting into the toilet is one of the biggest culprits of making you dizzy, particularly for men. When we stand up and urinate, we start to feel dizzy, and there is a distinct entity called micturition syncope. Micturition means urinating. Syncope happens to men and women alike. But more to men because we are usually standing up and emptying our bladders. So for men, if you can, sit down and empty your bladders. In Germany, most men will sit down and empty their bladders. These guys have done research from the World War time, seeing what happens to everything with what. And they knew it. This, and their systems are made as such. Believe it or not, in Germany they even have the plumbing pipes which are see-through. Some of you may say yuck. But they can actually see what's going out in their health. Is their blood? Has the color changed? So these are important things, that how do we change our environment in a way that we think is outside the box, but somebody is already utilizing. Only that our vision is not broad enough. When you are taking your medicines, you must have them all laid out. I take one pill. I take one pill which minimizes my risk of heart attack by about 50%, minimizes risk of stroke by about 50%, minimizes overall risk of death by 25%. But I sometimes forget, did I take my pill? So organize your pills in a way so that you do not forget. I'm sure the thought occurs in many of you that have I taken my pills if you've not organized them for the week or the month.
Correct.
And it is so important that you must, because otherwise you might over-medicate yourself. Over-medication with the blood pressure medicine means what? What do you think is going to happen? Pressure is going to go down. When the pressure has gone down significantly, what happens to the perfusion of the brain, which is the highest part? It drops. You have created the ideal situation, the perfect disaster situation for a fall. So organize your medications, take your medications to your doctor. If you have symptoms, if you have side effects of the medicine, make sure the physician is paying attention. The other day I had a patient where one word of what the patient said made an entire difference to what I was treating the patient for. The patient was having chest pain, which worsened whenever the patient laid down. So the entire situation of chest pain now became reflux. So every word that comes out of the patient's mouth is critical. So just be aware that your physician pays attention to the medicines that you're taking. You must take a list, and if preferably the entire bottles or everything, take everything with you. Because you may otherwise not write down the correct medicine. Even though in our systems, we have a way where we can extract all the data from your pharmacy and your insurance company to pull it into our system and see what exactly are you taking so that you don't make a mistake. We don't make a mistake because once we have wrong information, we will make a mistake or could make a mistake.
Who's responsible for updating those? Because patients get changed on medicine so often. Does it do it automatically as you enter it into the system, or?
Well, there are two people involved with the system. Both are responsible.
Okay.
Patient, physician. In this case, the pharmacy also updates it. If the pharmacy made a mistake of giving you the wrong dose, we will see. Hey, what happened? What happened to the new prescription? They're filling it on the refills of the old one. So these kinds of things are important. Sometimes your mail order pharmacy automatically sends you stuff and you don't even know, hey, an update went out and now I have a new medicine and another new medicine. Which one to stop? So a very nice thing is that what we do in our office is that as a patient is leaving, before they leave, we dictate the note. So our patients are asked, take a copy of my note as you leave the office. Because then you can refer back to it and say, okay, this is what's dictated over here. And you act accordingly. So clarity of instructions from physicians is important, and we know that patients do not retain everything that we say. Just like a mechanic might tell me 10 things to do in the car, I might only remember 2 or 3 or 4 or 5. Having forgotten the others because my attention was not on everything, and my understanding of these things is not 100% like the expert. Take written instructions. As you walk out with those, you will feel more confident. We will feel more confident that your care is actually being provided. For yourself, as you want changes in your circumstances, in your surroundings, for instance, have minimal thresholds. Yeah, you know what a threshold is? Like this is a threshold. Things that change and transition. This is a visual threshold. It's not a physical threshold, but visually it's a threshold. Somebody who doesn't have clear vision or in the night might mistake this to be something else and will have to alter his gait to do something which he didn't need to do. So keep things as uniform as possible. Let's see. I know I haven't looked at the whole handout, so that I make sure that everything's been covered.
Wait a minute, that's not it. Here you go. Those are the exercises.
Yes. Looking left, looking right. Most important thing is looking in the mirror. You should see something that you enjoy, that you like. Create that as well. You will look left, you will look right. Of course, look at all the good-looking people around you, which makes it a little easier to turn around. But of course, you know that is important during driving. during walking, because something might be coming from there and you will have your vision there. Even more important is having your mind open to looking. Because you may not see something, otherwise you will not pay attention. Today we see people just walking with their cell phones on the road. Yesterday we were in Miami. And we were driving on the road and we saw a young man, believe it, let's say if this is the road, and our truck, it's a big pickup truck that I have, we're driving in. This young man is on the road, in the middle of the road, texting something.
Oh my God, just standing there.
Just standing there, in the middle of the road. Are you kidding me? So my son, who's driving, he's 16, he comes and parks out there. And then he gives a honk. As soon as he gives a honk, this guy goes. You should not take risks in a place which is high traffic. If in your facility something is a corridor, it's a corridor. You get through so that others can pass through. So think about where you are. Look left, look right. There might be somebody walking right across and bump into you and you're going to fall. That bear hug stretch, I think is there simply to make you love yourself.
That's the point though. It's important to like yourself.
Isn't it? It's so beautiful. That's right. I don't want to stop. But the flexibility of a structure is very important. You know how they make skyscrapers? They make them so they're flexible. You know why trees don't fall easy? Because they are flexible. So for us to be able to stretch ourselves every way is so important. This is how you will be able to pick things up from the floor. You will be able to bear the trauma of either an uneven surface or a lost misstep or somebody bumping into you. Those things that cannot bend typically will be swept off or be falling. Taller you are, harder your fall. So very important to lower yourself to the ground as soon as you know you're going to fall. So that your body is not falling from that height, but actually falls from this height. We know that even reduction in trauma by 10% force, 10% of the force reduces, which is just this much, might be the key to preventing a fracture. Why am I saying this? Because a 5% increase in your bone density, just a 5% increase in your strength of the bone reduces the fracture rate by 70%. So your bones are also important. Your bone density, if it is not ideal, get it ideal. We know that there are excellent oral medications which are so inexpensive that they must be used and strengthened. Because if you don't utilize this, your bones have a 70% higher chance of breaking, either here or in the spine. As your spine collapses, your height goes down. Because the body knows that now it's getting ready to fall. It is going to lower itself so that it might survive the fall. But that's the wrong way to survive. That's the wrong way because your capacity to move has suddenly gone down. Your bones will be bent like this, which means they won't be nice and flat where they can move freely, but they'll be bent like this where it can't be twisted that way. So one joint is suddenly lost out of maybe around 15 major joints in the mid portion of our spine. So it's extremely important that you maintain strength of your muscles, your bones, flexibility of your joints, alertness of the mind, minimizing of side effects of medications which you do not have control over. So make sure that somebody who has control over them feels responsible. If you are reducing your weight, make sure that you head for it as quickly as possible so that the same force will have same strength in the legs, will have less work to do to keep you upright. You've already done the exercises. I'm not going to go over those because you did a wonderful job, and I myself couldn't do it as well as you have been because practice makes perfect. I'm here for questions.
I know nobody's going to ask you, so I'm going to ask you. Can you tell us the name of the pill that you take that's... What's the name of it?
Rosuvastatin.
Oh, I I take that.
Crestor.
Oh, Krista, okay.
Crestor.
How do you
So-
spell it?
Crestor. Most patients are not put on that. Most patients are put on atorvastatin, Lipitor.
Yes.
Crestor is 50% better than that. In our practice, we have abandoned the use of Crestor, of atorvastatin maybe 6-7 years ago.
Oh, it's a statin.
Yeah.
It's a statin, so now statins cause dementia. I don't know if you know that. Do you know that?
No.
But the lipid soluble ones cause dementia. Which ones are the lipid soluble? Atorvastatin. Lipitor is lipid soluble. Crestor is not lipid soluble. Pravastatin is not lipid soluble, but pravastatin is not as useful or as preventative as rosuvastatin. So we say, this is what we pick, we choose this. Through insurance, it eats up sometimes about $600 of your funding. $600, which means by the end of the year, one pill will eat up all your funding. But through us, it costs you only $15 through your insurance. So you have much more money left for other things that might be needed. So they're not falling into donut holes unnecessarily for something that can be obtained really inexpensively.
Does insurance give you a hard time about, and some insurances give you a hard time about spending the extra money for them?
Oh, see, what is the ideal thing for anybody to do? Do you want to order milk from Bloomingdale's?
Preferably not.
The answer is no. Because you will be spending so much money unnecessarily just because your son is paying. The answer is no. We all have a responsibility. So the responsibility comes to make our system survive, not just survive, but be able to give us better benefits next year. We can always write Lipitor, but I know that I'm not doing the patient a favor. So we write Crestor, we get it right out of, we have a dispensary in the office itself. We get it right out of our dispensary, hand it to the patient. Now, the insurance has certain things that it wants us to do. It wants us to make sure that the person is on the statin. So what do? We send the cheap one to the pharmacy and say, just please pick it up, put it aside, don't take it. We want you to take the best one. Because we can. So these things, for instance, if I write Cialis or Viagra for a patient, you know what is eaten up out of the funding? You know how much money?
No.
$20 a pill. Through our office, it is 70 cents a pill. So these are tricks of the trade that many physicians might know, but very few take the next step to say, what will I do about it? Which is critical. Because anybody can come and fix this wall, but will he fix it better than everybody at a price that's better than everybody or competitive is what we want. As we are strengthening a structure, which is you, the most important thing in you, in your life, and the lives of your loved ones, we must make sure that we can offer you the best with nobody crying about it. Not you, not the insurance, not us.
If you have a family, if a patient comes to you
Yes.
and has a really bad family history,
Yes.
wouldn't you think that you would want to order this over a Tavastatin?
6 years ago, we abandoned the use of this medicine. Atorva.
Really?
Yes. Causes dementia.
You're still on it.
Listen, I am telling you reality because I know reality, what happens out there. So it is important for you to say, who will I go to? You can have the best insurance in the world. Your car is in a crash. You can have the best coverage that is willing to fix it with whatever. But you have a bad mechanic. What do you think is going to come out?
Yeah. Okay.
Is that a generic for Crestor?
Yes.
Crest is the generic name.
No.
That's the brand.
That's the regular.
That's the brand.
That's
Okay.
right.
And then it's the generic.
Okay.
What's the generic?
The weight loss medicine that we use, you go through your insurance. What's the cost, Moises?
Average $1,600 a month.
$1,600 a month. For our senior patients, only for our senior patients who are our patients, what cost do we offer?
1/10 of that price, $160 a month, $40 a week.
So, but you have to have tricks, you have to know the tricks of the trade to say, how can we make somebody stronger in every single way? How can we, I have a patient, I just did a high five with her before I left the office. She started with us about a month ago. She said, doctor, I've lost 35 pounds. In a month. She could not stand. She was in a wheelchair. Just 35 pounds off, gone from her. Now she can stand. I said, I want 100 more gone. We will work together. And her question to me was, why has nobody done this for me before? I said, that is not for me to answer.
Patients from across town? Seriously?
My answer to her was, that is not for me to answer. The physicians you have seen in the past have to answer that question. So yes, it is very important, as I said, not just for your balance, these exercises, but an overall holistic look at your health to see what is being done for you. Moises has a patient who's just lost, what, 104 pounds now? 104 pounds gone. And this is, you will, if you come to our office, you will meet these people on a routine basis. These are not exceptions. Say, well, if you have 150 pounds to lose, I can help you lose 100. Now, what happens? I took that same medicine one time, 1 week. What happened thereafter?
You gained weight.
My appetite went down. I was looking at food right there. I was looking at food right in front of me. And I could see that my body is not craving it. Because what hurts us most? That we want it. We want it, but I know I can't have it. That hurts us more.
Yeah, it does.
When you say it's sitting here and I don't want it, you can walk on.
Right.
Makes a difficult, really, weight loss is tough. You would ask my wife, she's planned to lose some weight. One day she touched my belly and said, Gaurav, this needs to go. I say, well, she cares for my health. Why is that? Because central obesity is where all the fat starts to get into our arteries, starts to clog our highways. And when the highway to a small little village somewhere, a very critical village which sits in my heart, that highway gets blocked, what happens to that? Heart attack happens. So in order to build a better structure, we must keep our clean highways so that all the supplies, body has the means to heal, body has the means to feed, to improve, to clean itself, but some things it doesn't, which is where your physician steps in. This is the only statin, the only one that has shown to reverse plaque formation. Plaque is there, starts to shrink it. That is why we use it.
I have,
Yes.
if I can talk to you for just a minute. My husband died at 47 with a heart attack, massive heart attack. My sister died at 52, massive heart attack. My younger brother died at 65 he'd had like 12 different strokes. My twin brother had had surgery and has had a stroke. He has recovered pretty well from it. My daughter is 50 and she just found out that she had a widowmaker's heart attack when she was in Iceland a couple months ago. Came here, had some surgery, and now, they're watching her very closely. But we're still on, and my doctors know this. I mean, I had some problems with blood pressure.
You're not on a bad thing, but you're on the second best, not the best.
Oh, I see.
Okay.
So it's not bad, but it's
not
It
bad.
could be a little better. I want better.
Which is what we guys love.
I want
to do.
better.
We have multiple providers in the office. We actually give talks to each other. We take a talk and we discuss it. So let's say we will discuss COPD 1 week. The next week, what is the topic this month? This week, I think, is heart failure. Okay. Then I had given a talk on depression. But these are all professional level talks so that we all know what to do for our patients. And believe me, medicine is evolving so fast that if we don't do this, we will become that old doctor who only writes pain pills anymore. That's what's going to happen. And does your refills. All I do then start doing is don't even look at your medicine list. I just do, okay, what is there? Tell my nurse, please refill them, send them, we're done.
Right.
Well, now when you're talking about having these groups, are you talking about doctors that are in these workshops or patients?
Doctors. The patient workshops I do give. My last patient workshop was on longevity. So I do give talks, when COVID was not here, my talks would be filled with about 100 to 200 people. Because I enjoy it, I enjoy medicine.
Education is wonderful.
Medicine is beautiful. I am the top graduate of my medical school. I am the top graduate of my residency program. I am the top graduate for medical quizzing in the United States, Canada, and Mexico combined. I came to this area because I was promised a green card.
Yeah, you got a card.
The place where I trained, they actually said, Gaurav, you should apply for cardiology and we will support your application. It's a strong, strong Jewish hospital that I graduated from. And they said, you can apply to Stanford, Harvard, other places that are top-notch, and we will support your application for that. But when you come to America as the first generation person, you are more worried about being deported than you are about your career so much. So I said, okay, I first have to take care of my green card. So I came to Spring Hill, started practice, became the #1 practice in town. Today, if you look in Spring Hill and say who is the #1 individual practitioner in town, people will tell you. Doctors will tell you. We just opened our office here in Port Richey to make it easy for people to come and access something.
You're a group of doctors?
8.
8, okay.
Yes, 8 providers in all. And when somebody is well trained enough to say, you know what I do, you know exactly, you can take these principles and follow and deliver them elsewhere, is the level where Moises had reached. And I said, buddy, it's time for your personal growth. Let's get you there. So he runs the place. He has many things that I learned from him. So it always, for us, just like, if you are humble enough to understand that anybody can teach you.
Excuse me.
Yes,
Enlightenment is very good with me. Thank you very much.
Thank you so much.
I have to leave.
She has to pick up her son.
But any other questions?
Yeah, I've got a question. You're talking about falling, and I've always wondered why they always, you always talk about falling, but nobody ever teaches you how to fall.
Yes.
Is there any good way?
Falling happens so quickly. So quickly
Right.
that you wouldn't even know that it's happening and you can't plan for it. But there are a few things that you must not resist. There is a natural fall breaking reflex where your arms go out.
Right.
Let that happen.
Okay.
Don't worry about what's going to happen to your arm. You truly have to protect your brain. Okay? Then comes gravity. As you're falling there, if you can allow yourself just a few inches of dropping right in your position, when you drop, it'll be so much easier. As opposed to going down like this stiff.
Right.
So your legs still have some force to allow you to control the fall as you go down. Does that make sense?
There's no,
The
as far
program
as
also
falling
asks
to
me-
the side or.
No, doesn't make a difference.
Okay.
You're going to fall. See, falling is happening because uncontrolled circumstances are there. And you will not have the time to twist your body to do this. If you can, she dances, she told me. A dancer can do a whole lot more than a non-dancer. Isn't it?
Yes.
The way a dancer can move is like, wow, I can do so much more. Because my body, this is what I do for fun. So when the wrong circumstance comes, the dancer is much more equipped to prevent that fall. So what I would say is, start dancing. You will be prepared to make a quick movement when that time comes.
You don't even need a partner to do it. Music is move.
How about
He
boxing?
has a partner.
Well, you can always have a partner or a fantasy.
Yes.
Yeah,
So
I have
you can
my.
move faster.
I usually get my fantasy in my arms.
Aw.
She and I, every Saturday, we go to a dance class.
Oh.
We realize the importance of that because it is the #1 exercise to prevent dementia.
Show us.
Second one is ping pong.
Ping pong?
Ping pong. Yes.
Well, I have a friend who's 101, she taught dancing, and she still has all her faculties.
Yes. Why? Because the circuits of the brain from both sides are blending into highways. They're no longer country roads. They have been traveled so frequently with so many signals that they become interstates. That's how fast the signals are going through there with a dancer. Because with every beat she could move, you know. She could not just move, she could move that leg and lift this one up. You know, so this is what dance is, that you can do. Let's say we go to a flamenco class these days. Yes? And between us, we joke. Even in the car, I'll sometimes say, let's do it. It's planta, tacon, tacon.
See, I taught line dancing, not all this.
That is so beautiful as well. Because line dancing is so social, so grooved, so structured, that you will need to be opening your highways so that that memory remains. And these are beautiful highways. They will make you move better than anybody who doesn't dance.
Now, are you taking
I played,
ballroom?
pardon me?
Ballroom dancing?
We did. She and I actually had hired somebody who came to our house and taught us for the longest. And then one day she told us that she's a nudist.
Okay.
And then I think my wife never let her come back.
When she finally determined
Remember?
yeah.
I don't know how, but that fell off. But we do. When her father is here, I take him along with me. This is pre-COVID times, 2020, early 2020. Her dad comes and him and I go. We do line dancing.
Awesome.
Okay.
It is amazing.
It's fun.
Yeah.
Yes. What, the electric slide?
Yeah.
Yep,
Yes.
number one.
Of course.
We
Yes.
go Tuesday and Friday.
It is a beautiful exercise for balance, for the memory, sharpness of reflexes, and it's uplifting.
Yeah.
It is one of those exercises that you don't even realize that 2 hours of exercises have been performed. So,
Awesome.
because one song goes by in 5 to 6 minutes have already gone by and you don't even realize it. So it is really a lovely exercise. So we answered that question, how to fall. There was another thing that the program wants me to teach you is how to get into a car and get out of a car. Have you done that or not done that? Not done that? Okay. So how to get out of a car, I've looked at the whole material here and it did not teach us. But there are some academic institutions that have, so I'm going to get the car seat, that's it. So imagine that this is the car seat and here's the steering wheel. You open the door and you make sure that the door is secure and it's not windy and it's going to slam it back on you. Okay, so important. Then, or if you can hold the door like that, hold the door. Then you face, if there's the car, you see the direction of the car is over there. You sit yourself down and then you put one leg in and then you get the other leg in. Whatever other support you can get from things around you, please do. But keeping in mind that if you put it out here and the door slams, your hands are gone. So put your hand in the place where it's not going to go. Holding on to the steering wheel means holding on to something that is unsteady and may turn. So keep that in mind. So then I looked at what else is available. There are some $10 devices that are available. We have never used them. We have never bought them for our patients, although we buy multiple devices for our patients for different things. There is a little device that goes into that little opening in the, that little loop out there. As the door slams shut, there's a little loop.
Yes.
This gets into that loop and becomes a little handle. So that you have something steady to hold on to. So that as you climb in or out, you place that, get up, take it out, put it into your seat, car seat, and then go. When you come back, you open the car door, you pick that up, put it there, you hold on to it, come back again, sit down.
Where can you get them?
Amazon, Walmart.
Oh, okay.
Online. Walmart online, actually you'll be so surprised. Walmart online in many places, many occasions is way cheaper than Amazon. So it's good to look in both and see, and they can ship it to the local store or ship it to your house.
What do you call it?
What do you put in to get it?
I looked at car
Handles?
entry, car entry support.
Device.
Support devices, yeah. Let me look at it. If you'd like me to share it with you, I can share it with you.
Yep, that's what it is.
Our entry support device.
It's auto cane portable.
Yes, that's the one.
Auto cane?
2 words.
Auto cane portable. Portable. Oh, I see.
Then I also saw some other things where it's a little loop handle. But you know how they have it in Jeeps and stuff to hold on to?
Yeah.
Those are also sold. So you could take one of those and have it screwed in. Somebody could just screw it in for you on there. So they can hold it like this and then get in if you like. Or you turn around, hold that.
That's when it's in that little loop
Good
there.
idea.
Okay.
Anybody else want to see?
No, I brought treats today for everybody, but.
Amazing. So you want me to stop, I guess?
No.
I'll stop.
No.
No, don't
Continue.
stop.
But I mean, this is not on your diet.
What is the best way if you have fallen to get up?
So important. Don't be in a rush. Number one thing is don't be in a rush to get up. If there are people out there who make you feel embarrassed, shame on them. Truly shame on them. If you're in a position, in a spot where things are wet and you cannot get up, it's very important to put yourself in a spot which is dry, otherwise you get pressure sores. Okay. If you frequently fall, you must have a device where you should be able to call for help. I saw one lady over here wearing it, which was nice. They have a monthly subscription. I started looking at what I'm going to advise you and how much is it going to cost. Everything is a cost. That lady probably pays $50 a month
About, that's an average.
for that.
That's
She's got
hers,
hers.
varies
Yeah.
a lot.
Versus a watch.
Who has a cell phone?
We do.
1, 2, 3, 4, 5. Everybody has a cell phone. You can buy a device that coordinates with your cell phone. Even when you're home, when you go out, you take your cell phone with you, I take it. The watch device costs $60 flat and no monthly subscription. So something like that is what I would say, here we are. You're not, somebody's ripping you off for $50 a month for something that may or may not happen. Yes, I'm willing to invest that $60, $70 and buy that watch that Bluetooth connects with my phone and I can make a call right out there.
So what do you call it?
It was those who shall find shall see. Those who shall seek shall find.
Call.
You know, this room must be made out of lead. Because I can't get a signal here. I have 2 bars, but that doesn't give me enough to
Go by the door.
watch
Better call
fall. You know, because there is the Apple Watch,
Yeah.
but it costs $300-400. When something can, for the purpose that we're looking for, can cost $60 and we can get away with it, why not?
Are you wearing like two watches then if you have the other? Or
No,
is
it
it just
has
the
it
one?
has time. It monitors your heart, monitors a whole bunch of
Oh,
stuff,
okay.
and it's $60.
And
And
your
you can call out of it, so that it can connect through your phone. It'll call out. All these things are there. So people don't need to buy these devices that will run them $50 a month.
Yeah.
Spend 10 extra and have it for a lifetime. You know, you upgrade your phone, it works through there. If you'd like me to send these things to you, I can send these to you. Just Allison will need to take some numbers down, and I will send a phone call to you. Yeah? Because eventually, I'm not going to tell you to buy something that's going to cost you so much every month. You know, people are, and this is where the intellect of the person comes in. Does he care? Does he not care? And if I can get you the same thing for way better, that is my job. Because I'm not just helping you, now I'm starting to help hundreds of people. And this is where the care truly comes in. Hey, I'm not just saying, oh, go get this, because I've seen some specialists sometimes write a medicine, and the patient says, doctor, my copay is $200 on this.
That's right.
And they come to me. And I have to solve the crisis by finding them the alternatives that are equally good at a much better price.
It was $2,300 for 20 pills, and it had to be dispensers written. We tried everything else, and it was infection that we had to clear it up before we could do a graft.
What is it, linezolid?
I don't even remember, it's been years.
Most
now.
likely linezolid.
But I've never seen a pill that.
Yeah. There are pills, very,
I
very.
wound up getting it, finally, for $10.
So the
Yes.
solutions are there.
Yeah.
Just somebody has to look. Or know or look. Guys, what a lovely reception.
We have
you.
definitely,
Enjoyed it.
definitely
Very much.
enjoyed it.
I think there is new patients.